Hey everybody, this is Jessica DeMassa with WTF Health. What's the future of health? I am talking to the who's who of health tech and healthcare innovation, and today we are diving into a communications challenge. Oh yes, we are still talking about misinformation and disinformation around the COVID-19 vaccine. And on this anniversary, January 20th, of the day that the CDC recognized the first COVID-19 case in the US, we are going to be talking to these two guys who have been working together on a basic public service announcements of sorts to combat that disinformation and misinformation that is out there about the COVID vaccine. So please join me in welcoming Jon Reiner. He is the Editorial Director at 120/80 Marketing and one of the experts who appeared in this campaign for him. We have Dr. Carlos Del Rio. He is a professor of infectious diseases and epidemiology at Emory University. Gentlemen, thank you for joining me here today.
Happy to be with you.
I can't believe we're still talking about this, misinformation and disinformation around the COVID vaccine. I feel like this is a conversation that just will not end. So I want to hear about this campaign that you guys designed, developed, and executed on. But before we get to that, I'm hoping we can kick off, and Dr. Del Rio, I'd like to start with you, with a state of play on where we're actually at with this vaccine conversation. Are people still wondering whether or not they should get the COVID-19 vaccine? Is there still misinformation and disinformation about the vaccine out there? How has this conversation evolved, especially as we've seen more data come in and as more people have been vaccinated and time has passed?
Well, Jessica, this is a little bit of a story of the glass half full, right? The good news is about 62% of Americans have been fully vaccinated, have received, their 2 doses of vaccine against COVID, and another 25% have already received a booster. That's an incredible number. That's a lot of people. The bad news is there's still about, 35 to 40% of Americans that have yet to receive a vaccine. And unfortunately, among those, the number that are still thinking about getting vaccinated, starting the vaccination, is a precious few. I think most people that have decided not to get vaccinated are not interested in getting vaccinated right now. And that, to me, it's really concerning. And for example, today, we looked at data. There's more cases of COVID diagnosed yesterday than people getting vaccinated yesterday. So obviously, we are, losing the battle against the virus because we're not creating that immunity wall that was necessary by getting more people vaccinated.
How big of a role, Dr. Del Rio, I'm going to stay with you on this for a second. How big of a role do you think that this information that's out there that talks about, the questions, I guess, the scientific validity of the way that the vaccine was developed, how big of a role do you feel that that's playing in terms of preventing people from even considering it?
Among the people that have decided not to get vaccinated, misinformation is the principal driver at this point in time. It is people that simply, there's too much noise. And the problem is, besides the misinformation and the disinformation, there's also evolving information. And I think that's also creating confusion, right? When we first developed the vaccines, it was very clear that the purpose of the vaccines was to protect us from severe disease and death. And then by accident, by luck, it turns out that the vaccines also were pretty good at preventing infection. So we all got excited about these vaccines are great at preventing infection. Then we had the Delta wave, and we lost some activity against the vaccines, against protection from infection from Delta. And now with Omicron, we even have less protection against symptomatic infection from Delta. It's not zero, but it's less than it was initially. We still have very good protection against, severe disease and death. But as a result of that, people are saying, well, these vaccines don't prevent you from infection. And that, to me, in a way, it's based on uncertain truth. But they still, the number is not zero. They're still protect you. They're not just don't protect you as well as they did before. But that evolving changes in the available data also creates a lot of mistrust in people.
And that makes a lot of sense. And Jon, I want to turn to you now, and I want to hear a little bit, about where you guys started out in terms of this whole idea of, combating against some of the things that are out there that are just plain wrong and that were put out there intentionally to be wrong and to change the conversation around the vaccine. I understand, where Dr. Del Rio is saying now is that the conversation's evolving, and it's like, yeah, okay, so that makes sense that people are newly questioning, newly confused. But back when this all started, Jon, you directed the campaign, which is called Just the Facts on Vax, for those of you who want to look this up. So series of short videos featuring different different experts weighing in on, commonly asked questions about the vaccine, common misinformation, or I should say disinformation, because that's what you guys chose to focus on, stuff that was intentionally put out there that was wrong. Combating against that with actual fact, actual science. So Jon, talk to me, I guess, about what prompted the development of the campaign in the first place, and the value that you still see in it today as this conversation has evolved, as Dr. Del Rio has told us.
Thanks again, Jessica, for having me, and thanks for mentioning the campaign. So to start with, about last summer, it was clear that there was a medical answer to the public health crisis. Doctors like Dr. Del Rio had a hand in creating these vaccines, which were remarkable. I mean, their speed to market was incredible. The effect they were having on preventing infection was remarkable. But what was also clear is that, the vaccination rate was leveling off, in part because of a communications crisis. There is this concerted disinformation effort that's been going on since before the vaccine was brought to market to try to discredit it for reasons that have nothing to do with medicine. I was among the group of people who thought that there was an opportunity here to try to have a positive impact on reversing what the public health crisis was throwing at us through a targeted communications effort to battle this head on. So we chose to go at disinformation. As you said earlier, there are people who are they're misinformed. They're not opposed to the idea of getting a vaccine. They don't have all the information. But then there's this other classification of information we call disinformation, and that was generated by social media. There were a handful of groups who were called the Disinformation Dozen, who had an agenda to try to undermine the credibility of the vaccine, to reduce vaccine adherence for their own reasons, as I said, that had nothing to do with public health, that had to do with public chaos. And we were able to identify them. And as a result, we were able to target a campaign that went directly at the claims that were being made by disinformation organizations, and also the geographies where it was most prevalent. So 120/80 marketing, where I work, decided that, well, we're not in the medical business, but we were in the digital healthcare communications business. We're going to harness the two. We're going to create a PSA campaign. We wound up with 20 short videos featuring experts like Dr. Del Rio, who's an immunologist. We also had OBGYNs, we had nurse practitioners, we had epidemiologists, we had doctors from across the spectrum of the medical profession address head on the disinformation, claim by claim by claim. And the way that the campaign was designed, the end result was to direct people to be able to access information, which would then show them where they could get a vaccine. This wasn't just to put information into the conversation without an end result. This was really to drive vaccination rates. That was the motivation.
Okay. All right, so where we're at now, then I'm curious, Dr. Del Rio, do you think it's even possible to convince some of these folks who haven't been vaccinated yet to get vaccinated? And I'm going to ask in the context of, too, the fact that children are now getting vaccinated. So now maybe as parents are thinking about their kids instead of themselves, and we're looking at, what do we do with the younger generation? I mean, do you think that if there is an opportunity here for us to still increase the vaccination rate in the country?
I think so, and it will happen through requirements, right? It will happen because restaurants will say, in order to come in, you need to be vaccinated. In order to attend the show, you need to be vaccinated. In order to travel, you need to be vaccinated. So I think a lot of people who say, well, I may not get vaccinated, but pretty soon they'll find themselves as being restricted of doing certain activities, will choose to be vaccinated. But I don't think, again, that it's going to be millions of people. And I really, again, I see our country pretty stuck at 62% fully vaccinated. So maybe we can get that up to, 70%, but still, I would have loved to see us be, in the upper 80s, 90%. Now, there's a patchwork across the country, right? There's cities like San Francisco that have 80+% vaccinated, and there's places down in the South where we have less than 45% vaccinated. So it really is not one vaccination acceptance rate across the country. Is really community by community. So you may get some communities that the vaccination rate will go faster than others, but there's some communities that no matter what you do, you're not going to get many people vaccinated.
John, do you share in that point of view? Or I mean, I weigh in on this because I mean, like you're studying this from the communications standpoint. Do you think there's anything that can be said that might help impact and raise up those vaccination rates, or are we going to leave it to the medical expert here?
I think if we look at our own campaign, we have some evidence, that we can extrapolate. So we ran this campaign from around Labor Day to the beginning of November. As I said, we had 20 episodes, and we were narrow casting, and we were giving emphasis to geographies like the South that Dr. Del Rio alluded to, and other places that have low vaccination rates. I know that we had people who went through our messaging who then chose to get vaccinated. By our count, we made more than 1 million impressions and about 400,000 engagements, and about 2,500 people went through and then sought out a vaccination. Now, I know that's a small number compared to the millions of people who need to be vaccinated, but it's the only way to make it happen. There are two ways to make it happen. One, the doctor alluded to mandates. So mandates will work, but also a patchwork, like the doctor said. So I think what we need to do is use communications, to combine the effort to change behavior. And I think, again, it makes sense to be smart about it. It makes sense to be targeted, to go where, the real shortfalls have taken place.
All right, what do you guys have to say about other medical or medical disinformation and misinformation? Because I mean, leaving the vaccine out of this for a second, I'm curious to hear what both of you, after having gone through this whole campaign, and watched it make an impact and deliberately sought out some of those questionable, concerns or questionable comments that were made about the vaccine. Like, what can you extrapolate from that and share with the audience here, about dealing with misinformation and disinformation in healthcare? I mean, I've got a lot of healthcare professionals who are out there in varying roles, right? And I mean, and this is definitely not the only time that there is, bad information out there about something. I mean, there are other vaccinations, with people's children that, there's questions about the science there. There might be pharmaceutical drugs that people wonder about, and there's, disinformation or misinformation out there about that. I mean, John, I want to start with you there on that. Like, what lessons have you learned from communicating against misinformation and disinformation that you think broadly the healthcare community that, has a job to communicate the truth can take away from it?
Mm-hmm. Well, I think we live in an information age, and that's one of the results of that is information overload, both good and bad. So if you feel that information can be used for good, I think you have to be utterly scrupulous about it. And we felt that we were that way in recruiting the medical experts that we did. We knew that it wouldn't be enough for a communications agency to say to the public, this is the science, you should pay attention to it. There was going to be a credibility gap there. So we wanted the experts to do the talking. And I think that's how communications works best. It always comes down to trust. Trusting in the messenger will get you to trust the message. It was the same with our campaign. And I would say for anybody who's in the communications business and is interested in having an impact on public discourse, you've got to put your own ego aside and your own corporate agenda aside and be an instrument for the truth. Deliver the facts, deliver the science, deliver the truth. Use your expertise to be able to get it to the right audience and to put it in a form that is going to be understood and digestible. But really rely on the information more than ever. And I think there's a certain amount of effort that's required to make sure that what you're delivering is accurate, won't be challenged because of its veracity, and that it really is addressing what is the pressing issue, the pressing need at the time, to try to stay focused.
Dr. Del Rio, what about you? Like, any advice that you would give any other clinicians who might be, pinged for coming in and providing, an expert perspective as a spokesperson? I mean, I feel like we all saw poor Dr. Fauci, at the beginning of the pandemic. I mean, he just got roasted, and it's like, it's a lot to put yourself, professionally out on the line like that and speak for what is the truth against, a very, very vocal and a lot of times a very, feisty group maybe that lives in a world in social media that is combative. So, I mean, what advice would you give other medical professionals, when even maybe the family doctor in a community who plays a role as a trusted advisor, how do they serve best as a spokesperson, particularly against some of the issues that might be out there about that are incorrect, misinformation and disinformation in other areas of healthcare?
Well, I will start by saying that, as John said, we live in an information age, and we live in a social media information age. And part of the problem that we have is that through social media, you kind of build your echo chamber, right? And you listen to the people that you like to listen. And so the first thing is you have to actually sort of penetrate the other side. You actually have to, you have to do interviews in the other media. You have to be able to confront and to get into that in a very respectful but direct way. The other thing is you're going to have to be able to state the facts, and you're going to have to be able to base your facts on data, and you're going to have to be able to engage in a respectful way in disagreeing, and be willing to be attacked. I think one of the things that you learn is that in social media, the attacks could be relentless, and people can be can be pretty aggressive, and you need to be able to do that and to withstand that. But the other thing is, I think it's really important to tell patients and to tell family members and others to really check the sources of information and to really check what they read. And just because they read something in Facebook doesn't mean it's true. Just because they read something here or there doesn't mean it's true. And you have no idea the number of family members or friends that I have who send me a clip or send me something that this was in my Facebook feed. What do you think? And it's clearly a misinformation. And yes, it's a little bit of a pain for me to have to tell them that is not true. But in a way, they're trying to check the source of it. They're trying to make sure that that is indeed something that is worth reading or not. So that's the other thing, that you're going to have to dedicate some time to answer people questions, because as people find this kind of misinformation, they will come to you and say, "Hey, is this true?" And I can give you many examples, but I can remember, somebody that I know that I think it's intelligent, and it's somebody who I think highly of, send me this thing that there is some piece of metal attached to you in the vaccine, and showing that penny that you could put in your arm and get stuck there, saying, "Is this true? Does the vaccine put a microchip in you?" And I'm glad she sent it to me before she disseminated it to her friends or she started believing that. But again, I had to spend time to respond to that and say, "No, what you heard, what you saw is not true. This is misinformation, and you need to be careful. Please discard that and ignore it." But like that, there are many times. So I think part of what you need to also learn is that you're going to have to spend some time doing that, because if you don't, then people think that that's the truth.
Yes, if I could just add to what Dr. Del Rio said, a couple of things. First off, you're asking what's required. As the doctor discovered firsthand, courage and perseverance and patience. I mean, with all 6 of our doctors who participated in the campaign, I mean, we were honest with them. They were certainly expecting that there were going to be opposing views, orchestrated campaigns to discredit them, to attack them personally, ad hominem attacks. They faced all of that, but they were relentless and they were courageous, and they weren't going to let that deter them. The other thing is, this is a simple truth. The truth will set you free. And I think for anybody who's in the communications business, you have to abide by that. Now, it's true that information changes. We know things about the disease, and we know things about the therapy now that we didn't know a year ago. So of course, you have to be responsive to changing information. But ultimately, it comes down to a willingness to take this on head on, to not be deterred by what's going to be thrown at you, but also to be patient. As the doctor said, you've got to go where the threat exists, where the disinformation exists, and be willing to address what's being thrown at you. Persuading, changing people's views is a long process. It doesn't happen quickly, and we live in an impatient world. Social media fosters impatience. It's hard. You've got to counteract that in your own behavior and your own commitment. This is a long-term commitment to getting the truth to will out.
All right, well, we will stay patient. We will continue to put out there the good information. Jon, real quick, where can people find the Just the Facts on Vax campaign? If they want to take a look at the videos, maybe send them to some of their loved ones or post them on their own Facebook feed, where can they find them?
Absolutely. So if you just type in hashtag Just the Facts on Vax, it is on every social media channel. It's on YouTube, Twitter, Facebook, Instagram, LinkedIn, and you will find the 20 videos on those channels.
All right, guys, pick your favorites and share them. We love talking to these guys. Thank you so much for getting us up to date on where we're at in the vaccine conversation now. And hopefully, folks out there will, continue to, I guess, be curious and look for the right information, and maybe we can change some minds. Fingers are crossed, fingers are crossed. Thanks so much again for joining me. Dr. Carlos Del Rio from Emory University, Jon Reiner from 120/80 Marketing. Thanks again. I appreciate your time.
Thank you, Jessica.
Thanks a lot.
All right, guys, to check out more interviews with the who's who of health tech as they're changing the way that we do healthcare, please check out my YouTube channel. Nothing but truth there. It's over there at youtube.com/WTF Health. We'll talk to you guys soon. Thanks so much for joining us.